Until the late 1980s, the medical community widely believed that newborns couldn't feel pain due to their still developing brains. Today, however, many leading medical organizations acknowledge that a fetus may be capable of feeling pain as early as 24 to 25 weeks of gestation. At 24 weeks, fetuses already show physiological responses to harmful stimuli such as elevated heart rate and increased blood pressure. By 30 weeks, brain activity appears in regions specifically linked to pain processing. The ability of a fetus to truly experience pain and develop awareness largely depends on the maturation of its nervous system. The cortex, the brain's outer layer, plays a crucial role in pain perception. The thalamus, another key structure, acts as a relay station, transmitting sensory signals, including pain, to the cortex. During the early stages of fetal development, both the cortex and subcortical regions like the brainstem and thalamus remain immature, with synaptic connections still forming. This means that early in pregnancy, the brain lacks the hardware and software needed to support conscious pain perception. Still, some theories propose that a fetus might feel pain much earlier, possibly during the first trimester, up to 12 weeks. According to these views, the neural pathways for pain detection may begin forming as early as 7 to 8 weeks of gestation, with pain receptors and spinal cord connections linking to the brain by around 12 to 15 weeks. Yet, current evidence strongly suggests that the likelihood of true pain perception before 28 weeks is low. Experts now understand that pain perception isn't tied to a single brain region or isolated connections, but rather relies on a complex, integrated network known as the human pain connectome. In situations where fetal surgery is required, doctors administer analgesics directly to the fetus, either through the umbilical cord or via intramuscular injection to ensure it does not experience pain during the procedure. When medical interventions are performed on a pregnant woman, medications given to the mother can cross the placenta and reach the fetus, providing some level of sedation. However, this is often not enough to fully prevent fetal pain or stress responses during invasive procedures. To reliably blunt these stress reactions, direct fetal administration of opioids is still necessary. When it comes to abortion, the topic of fetal pain and its management becomes even more sensitive and complex. Advocates for reproductive rights stress a woman's autonomy, the right to make decisions about her own body, including whether to terminate a pregnancy. At the same time, there are medical circumstances in which a doctor may recommend a therapeutic abortion, such as severe fetal abnormalities, pregnancy complications, or significant risks to the mother's health. Yet, some argue that the fetus's potential to experience pain should also be considered when making these decisions. The vast majority of abortions occur early in pregnancy. About 91% take place before 13 weeks, and 7.7% between 14 and 20 weeks. According to the latest abortion statistics for England and Wales, 2021, only around 1% of abortions are performed beyond 19 weeks of gestation. In early gestational abortions, typically up to 12 weeks, specific pain management for the fetus is not used. This is partly due to the uncertainty surrounding pain perception at that stage, and the potential risks of introducing additional medication to the pregnant woman. During these early procedures, the primary focus remains on the safety and well-being of the mother. For abortions performed later in pregnancy, past 20 to 24 weeks, some practitioners may recommend medications to help reduce maternal sedation or anxiety. While these drugs are primarily for the mother's comfort, they can incidentally provide mild pain-relieving effects for the fetus. But pain isn't just about physical sensation. It's also tied to emotions and cognitive processing. Anxiety, fear, depression, and past experiences can greatly influence how pain is perceived. When a pregnant woman experiences stress, her body releases hormones like cortisol. These hormones can cross the placenta and reach the fetus. Although it's unclear whether they directly cause fetal stress, They can alter the fetus's heart rate and movement. Prolonged exposure to maternal stress may even have long-term effects on the fetus's neural development and mental health. Even if the fetal brain cannot consciously process pain in the same way an adult does, developing pathways could still send stress signals triggered by the mother's emotional or physical discomfort. Research increasingly shows that a mother's emotional state can influence fetal well-being in various ways. Positive emotions support healthy fetal development, while negative emotions such as anxiety or depression can negatively impact the fetus's stress responses and neural growth. This connection likely involves more than just hormones. Maternal-fetal bonding and emotional communication through nonverbal cues also play a role. A supportive partner can make a significant difference, offering comfort, listening to concerns, and helping manage mood swings. Studies have shown that women with supportive partners tend to experience lower stress levels during pregnancy, which benefits both mother and baby. Ultimately, the concept of fetal pain perception is complex, and scientific understanding is still evolving. The development of pain awareness in fetuses is a gradual process, and it remains uncertain at what point they become fully capable of consciously experiencing pain.